Australian Prime Minister Scott Morrison announced today that Australia is working with Papua New Guinea to support the government's response to a concerning spike in COVID-19 cases. Morrison said Australia will supply 8,000 AstraZeneca vaccines to enable vaccination of the country's essential health workforce, with an initial rollout for the National Capital District. The Australian government will also make a formal request to AstraZeneca and European authorities for 1 million doses of Australia's contracted supplies to gift to Papua New Guinea. The Australian government will also work with the PNG and Queensland governments to address health security on both sides of the Torres Strait, including support for making vaccines available in a timely way in treaty villages in the protected zone. Australia will also deploy a forward team of 3 AusMet health specialists to Port Moresby to work on infection control, triage and emergency management and public health measures. Australia is also providing the following new targeted support: supply of PPE and other equipment, supporting St. John's, PNG and the National Capital District Provincial Health Authority to establish the Taurama Aquatic Centre as an isolation facility, and reopening of the Rita Flynn Testing and Isolation Facility, scaling up surveillance, testing and clinical care capacity in Port Moresby and provinces with known outbreaks, and testing of samples in Australia. The Australian government will also provide over 1.5 million essential PPE supplies to the PNG government, including surgical and respiratory masks, gloves, hand sanitizer bottles and face shields. This new support is in addition to the $144.7 million support that Australia is providing to PNG between 2020 to 2021 and 2022 to 2023. Since the beginning of the COVID-19 pandemic, Australia has already provided assistance of over $60 million to Papua New Guinea. Cedric Pajole, TV1 News.